Tiny Tim, a cavalier type dog approximately 5 to 7 years old. He was rescued in August 2012 and neutered by the rescue. He had previously been used as a stud dog in a commercial dog breeding farm. In August 2014, he suffered a traumatic injury when a large dog ran into the back of him whilst out walking. This video was taken the evening after the accident. It's quite clear he's unable to weight bear on the left hind. He has the stifle flexed and the hock extended. There is pain on palpation, but no movement. X-rays were taken and they showed damage to the lumbar vertebrae, causing trapping of the sciatic nerve. Once he was able to walk, hydrotherapy was started. This is his second hydrotherapy session. The effect of the water highlights his lack of coordination, his inability to protract both hind limbs, but particularly worse on the left-hand side. When viewed from the front, his hind limbs are base wide and the forelimbs are providing the bulk of the power to propel the body forward. Tiny Tim was probably kept isolated in a kennel during his time as a stud dog at the commercial puppy farm. This would have caused a lack of exposure and stimulation. As a result, he's developed serious canine obsessive compulsive disorder, or OCD. Sadly, this manifests itself mainly in the form of shadow chasing, but he also displays spinning, licking and biting, and he can also become aggressive if any person or other dog blocks him when he's performing these behaviours. This footage has been edited down from well over 10 minutes, and the behaviour on this occasion was caused by excitement due to food preparation. He can also physically hurt himself whilst performing the OCD by falling over, hitting walls or bashing his head on door frames. As you can see, the spinning is violent. In stance, right lateral view. There is arching of the back through the thoracic lumbar region. The hind limbs extend behind him and there is poor muscle definition through the hamstring muscle group. When viewed from the left side, there is muscle hypertrophy of the hamstring muscles, which is more apparent. And on this side, the quadriceps are also underdeveloped. There is good muscle development across the scapula and the pectorals are hypertrophic. From the cranial view, his hind limbs are base wide. Again, this is demonstrated in the caudal view. In walk, he finds the slow pace difficult to maintain, and to avoid going forward, he sways left to right. When trotting, it is significantly improved and he can maintain straightness. The trot shows poor protraction and retraction of the pelvic limbs, with the retraction phase being particularly limited. There is also limited flexion of the joints, specifically the tarsal joint. There is not an even stride length with the pelvic limbs, with the left taking a shorter stride and also having a lower flight arc. Slow walk viewed caudally, there is rolling of the pelvis, which is to compensate for the reduced pelvic joint range of movement. On a circle, there is a lack of bend through the vertebral column, and at walk he frequently paces. The reduced retraction of the pelvic limbs is clearly seen, and his back remains arched through the thoracic lumbar region. The walk gives the appearance of the forelimbs pulling the trunk forward rather than the hind limbs propelling the body forward. He also has a short, choppy stride. He finds circling difficult both to the left and the right. And the lack of flexion and extension through all the joints of the pelvic limb is very apparent. Even at a faster pace, he finds it difficult to maintain any consistent speed on the small circle. He is also base wide through the pelvic limbs. This is more apparent in walk, but is also clearly seen in trot. At a faster speed on a larger circle, there is a much more even stride length, an increased protraction and retraction of the hind limbs, with greater joint range of movement. The rocking of the pelvis is also reduced. The sit to stand exercise is performed easily, demonstrating normal pelvic range of motion. He doesn't appear to display any discomfort when repetitively asked to sit and stand. Again, the lateral view showing the arch in the lumbar thoracic region of the spine. This caudal view clearly shows the hypertrophic nature of the semitendinosus and membranosus, biceps femoris and quadriceps. This is probably due to the lack of protraction and retraction within the stride, and is more noticeable on the left side to the right, demonstrating a weaker side.